Just to give you some background on this clinic, we see approximately 10,000 patients per month at this clinic, and there's a very vigorous walk-in component here, and we obviously need some pretty vigorous hardware in order to accommodate that volume of patients. This actually isn't a very functional piece of machinery. If this was actually taken from the clinic, the person who took it couldn't even use it. So that's an added additional security feature to these Sunrays. And then when I come in every morning, I just put the card in and I log in to the server, which is a server that's remote from this clinic. It's in this very secure location in the downtown core of Calgary, and we've developed a relationship with a company that allows us to, they provide the server and all the support for it. And once we log in, we then launch the electronic medical record through a conventional sign-in. And one of the neat things about this is that, say I'm opening a patient chart, and I open it up and I get called away, or the patient arrives and I'm reviewing their chart, and then I want to go to the room, I simply take the card out, it locks down this terminal, and I simply walk to the next terminal, and I go into the exam room. And I go into the exam room, I take the card, and I simply slip it into the card, and it comes up in the exact same place in the chart where I left off, and then I can start working again. Alright? Similarly, I'm done with the chart. I sign out on the chart, whatever I need to do, I give the patient the prescription, they go on their way, I take the card out. Notice it's completely locked down, so it's a completely secure piece of hardware. And that's one of the advantages of using the Sunrays is the security, and then it definitely is important with respect to patient confidentiality. And then I go to the next exam room. I slip the card in, and lo and behold, it's the exact same spot that I left it at with the patient chart there. All right. And that quickly demonstrates how I can use the Sunray terminal in a busy value medicine clinic, and I can go from room to room seamlessly, and that's a huge time savings. Print a prescription here. So let's just do a new prescription. And let's just take a prescription. And we'll have it for, say, a week. Just a typical antibiotic prescription. You print it up. It should come on this printer here. It comes out. And you have your prescription. All right. Let's go to the next room and I'll show what we can do. And this is a capability called Follow Me printing that Siebel Systems has developed in conjunction with Sunray. And let's try the same thing again. Click the quick print button. I don't know if you quite see it here. And I click it again, and it prints at the printer that, so the card is smart enough to follow me. Well, not the card, but the way in which the system is set up. It's smart enough that I can actually go from room to room, and I print at whatever location I'm at. So that's another feature that we have that's quickens the speed as well. All right.
We partnered with the PCN, and I have to say that we were extremely happy with the help, especially with the technical input, the research that was done into all our previous contracts and so forth that was done by the PCN. So very helpful, and they made the transition much easier than what it would have been, as well as much more financially affordable. We probably would not have been able to do so if it was not for the help of the PCN as well as POSP. So very happy with the transition. Given a clinic that's 20 years old with 170,000 patients on file, it was relatively easy. As far as the Sunray system goes, we're really pleased with it. Initially, I have to say I was skeptical, but the security and the ease of use has really made my life much easier. I can come into an exam room where a patient would be sitting the screen is completely blank and secure. There's no way that they can access any of the data. And I just come in with my card, I slide it in, and I have the patient right in front of me. And I can start with my consultation right off the bat.
Key components to the whole integration of the system is having the right people doing the right kinds of work. I think there are some physicians who are very savvy with computers. Myself, I am not one of those. And so to have someone that can advise us and give us good information that's you know, unbiased and lead us in a direction where we can make educated decisions on what kind of systems to put in place has been absolutely pivotal in the whole process of switching over. So having the PCN helping us out with that has been fantastic. Almost 100% of the docs are now using the cards at their desks. So within 3 to 4 weeks, we went from having 3 or 4 computers to the entire clinic has been switched over. It's fantastic technology. The fact that we can walk down any hallway, grab any computer, put our cards into it, and have access to the last thing that we just finished off doing is worlds beyond what we were doing before. Having to sit down with re-entering passwords, re-logging onto systems, it just bogs us down. So frees me up with for more time to see more patients, and I'm more efficient because of it. So.